So welcome everyone. We're really excited to have all of you here and joining us for the 60 years of migrant health. Next slide. I want to start off by thanking the campaign, the Ag Worker Access Campaign Task Force. This is a group of individuals that represent many different organizations. You see them here on this slide, but they have helped us to develop the content for this presentation and are sponsoring this on behalf of the Ag Worker Access Campaign. Next slide. So today we want to spend a little time sharing with you a historical timeline regarding the Migrant Health Program. We want to spend some time with two individuals from health centers that will share with us their stories. And then lastly, we want to share with you tools and resources that you can use in your own community or with your own health centers or with staff to provide them with information that will help them understand the Migrant Health Program, the importance of farm workers and the work that is being done around the country in farm worker communities. Next slide. So why are we hosting this webinar? Well, it was very important for the Ag Worker Access Campaign Task Force to really think about how can we commemorate the 60th anniversary of the Migrant Health Program. So first of all, we do want to celebrate the 60 years of migrant health. It's quite an accomplishment. We want to highlight the role of health centers in the migrant health movement. We want to continue to recognize farm workers as well as healthcare workers as essential to our society and the functioning of our society. And we want to take this opportunity to keep the goal of the campaign alive. Next slide. So we have some poll questions for you. And this is just to get an idea of your knowledge about some of the content we're going to be sharing with you today. So take a few seconds to answer the poll questions, and then we'll share the results with you. Sylvia, are we ready to see the results? Okay, so poll question 1, which of the following events led to the legislative action that approved the Migrant Health Act of 1962? So it looks like the majority of you, so 68%, correctly answered the question. And we'll talk a little bit more about how all these events really had some factor in the legislative action of the Migrant Health Act of 1962. So the second question, let me see if I can scroll up. There we go. So the Migrant Health Act of 1962 established the provision of health services for, and again, you had the options of migratory and seasonal farm workers, migratory, seasonal, aged and disabled farm workers and their families, and then migratory farm workers and their families. And so this is a bit of a trick question. So I will let you know that the correct answer is migratory farm workers and their families. But we'll talk a little bit more about how some of those other groups were added as we evolved in the program. And the third question, the Ag Worker Access Campaign attempts to, and these are some of the options you had: identify and celebrate migrant health champions, increase the number of farm worker families accessing healthcare services, build and support multi-sector partnerships, or all of the above. And again, once again, the majority of you have that correct. We do as part of the Access Campaign Task Force and the campaign, we do try to do some of all of those different, very important activities. So thank you so much for participating in the poll. And we're going to move on to the presentation. As I mentioned, we have a lot to cover, and we will have some time at the end for questions. Next slide. So I want to start off with sharing a little bit of information about the history. And we know that the history of migrant and seasonal farm workers is almost as old as the country itself. And farm workers have always lived in the shadows of communities, living and working under hazardous, unsanitary conditions while surviving on meager wages, with sometimes very poor access to education, welfare, and healthcare. And as a country, we have relied on cheap labor for hundreds of years, and the workforce has been comprised primarily of immigrants. Again, today I want to share some highlights from our historical timeline. We have a complete version with detailed notes that you can use from our resource section, and Alicia is going to discuss this later in the presentation. So in the 1600s and through the 1700s, the agriculture industry first relied on indentured servants from Europe, and later from African people brought as slaves to the country. But as farming production expanded in the 1850s, especially with the introduction of new machinery, farming methods improved, and advances in transportation, there was an increased demand for temporary and migratory seasonal labor force. At that time, immigrants from several countries were brought in by employment agencies to meet that demand. So for example, along the East Coast, you saw African Americans and Port Anglos that were joined from newly arriving European immigrants. And the West Coast, we had farmers that were hiring large numbers of immigrants from China, Japan, and Mexico. And in the South, the seasonal needs were met by slaves, and after the Civil War by former slaves, Native Americans, and Port Anglos. Then in 1917, when the US entered into World War I, the country was faced with a growing wartime food demands and increased shortage of agriculture laborers. And in response, Congress passed for the first time an Immigration and Nationality Act of 1917, which for the first time established a legal basis for the importation of some 73,000 Mexican workers. But soon after that, the agriculture economy worsened with the onset of the Great Depression in the 1920s. And in an effort to open up jobs to native-born citizens, the Immigration and Naturalization Service cooperated with local authorities to deport Mexican immigrants and Mexican-American citizens by the thousands. In all, more than 400,000 repatriados were deported. These were individuals that, again, were deported because of this action. So although now domestic workers were initially reluctant to fill those migratory labor positions, they were left with little choice following the droughts in the mid-1930s. Farmers in these areas were soon displaced, giving way to the tough economy, dusty conditions, and land foreclosures. And this time period, as you may know, was known as the Dust Bowl. Excuse me. They became the new migrants, and they traveled to California and other regions in search of work and substance. These are some famous pictures that we all have seen around the Dust Bowl area and farm workers. But a light amongst this depressed time is the Farm Security Administration, and they had a really important role during this time. It was initially established to provide rural relief for farm families seeking aid during the Great Depression. And they primarily received aid in the form of loans for machinery, land improvements, and things like that. However, the FSA recognized the importance of a healthy workforce. And in 1937, the FSA Health Service Program was developed, which in addition to other services, they also funded agriculture workers' health and medical associations. These associations built really small health clinics that were really provided along the FSA labor camps. And during this time, outreach nurses were stationed at each of these camps to hold daily sick call and to teach people how to improve and maintain their health. And although the program ended in 1947, it became a great model for the future Migrant Health Program, which was created almost 20 years later. Next slide. Now, the United States entered World War II on December 8, 1941, after the bombing at Pearl Harbor. To meet the challenge of war, industrial and agricultural production increased, and much of the nation's human resources were diverted to the military. The United States once again called upon Mexico to fill the labor void. And the two countries signed the Bracero Agreement in 1943, which began the importation of laborers or braceros, strong arms, from Mexico to work in the United States. So although originally it was devised to meet the World War II shortages, the Bracero program continued until 1964 under a variety of legislative authorities. And ultimately, it employed 5 million Mexican laborers. Next slide. So as the initial phase of the Bracero program ended in the early 1950s, and the number of migrant workers grew larger and larger, two presidential committees were established to investigate various aspects of domestic and foreign migratory labor. The committee's research revealed poor social, economic, health, and educational conditions of farm workers of the day. Also of note, in 1952, the Immigration and Nationality Act that created the H-2 program was passed. This authorized the legal importation of foreign workers. And then in 1954, the first ever East Coast Migrant Conference was held with the goal of developing ways to extend health, education, and welfare services to migrants and their families. And as many of you may be aware, the first Stream Conference set the stage for our current 3 Migrant Health Stream Forums, which are presented annually to support the work of community and migrant health center staff and other farm worker serving organizations. So within this, there's just a really rich history of the conferences and how important they have been over the years. Next slide. So really interesting to note is that following the East Coast Migrant Conference, the Surgeon General requested that the Public Health Services Division of General Services develop a program to address the proposals and recommendations that arose from the conference. And to administer this new program, a migrant health unit was created within the division. And for those of you who have been in the migrant health field for a while, you will remember that when the Bureau of Primary Health Care, within the Bureau of Primary Health Care, there was a migrant health branch. Well, this branch evolved from the migrant health unit. And although the migrant health branch no longer exists, it made significant contributions over the years to the work that was done by migrant health centers and the advancement of the migrant health program. So at that time, 2 of the unit's greatest accomplishments were the creation of a density map, which I love to see. Of those of you that know me, I love data, and NCFH has always been involved in understanding the estimation and looking at population estimations and understanding the demographics of farm workers around the country. So this density map provided peak migrant population estimates for each county in the US. The other project they had was called the Texas-Michigan project, and it intended to demonstrate the migrant health unit's ability to coordinate the efforts of 2 separate state agencies as they attempted to meet the health needs of migrants as they traveled from Texas to Michigan. Some of you may recall that there's these historical migrant streams, and this was one that was very much a stream that had many families moving from Texas to Michigan to do farm work. And interestingly, both of these projects are still very relevant today. Understanding the population estimates of farm workers in an area and continuity of care for a migratory population. Next slide, please. So now we're to the 1960s. And public awareness of migrant farm workers and the conditions they live in are surging during this period of time. One of the pivotal moments in this era is the airing of Edward R. Murrow's documentary titled Harvest of Shame. It aired the day after Thanksgiving in 1960, and the airing on this day was very purposeful and it was very strategic. The intent was clear. It wanted to stress the fact that much of the food cooked for Thanksgiving throughout the country was picked by migratory workers. The program detailed the exploitation of migrant farm workers by large agribusiness and highlighted their poor living and working conditions. If you have not seen this documentary, I highly recommend it. So in addition to the documentary, the farm labor movement of the 1960s with Cesar Chavez, Dolores Huerta, and others had a great impact on the public and the lives of farm workers. As a result of this growing public awareness, a Senate subcommittee on migratory labor began working on a comprehensive bill to address a variety of migrant labor concerns. The bill emphasized the need for a simple, flexible program adapted to the needs of migrant workers that focused on the provision of health services. The bill passed both houses of Congress and was signed into law by President John F. Kennedy in September of 1962 as the Migrant Health Act. Next slide. A number of advances were made in the 1960s related to labor, health, and education. The Migrant Health Program was reauthorized in 1965, adding hospitalization to the scope of services provided by migrant clinics. And by 1969, 118 projects were in operation, serving 317 counties in 36 states and Puerto Rico. And again, keep in mind that this initial act, the Migrant Health Act, initially was only serving migratory workers and their families. Next slide. So now in the 1970s, there were additional changes made to the Migrant Health Program. Now we see seasonal farm workers added to the eligibility for grant services. In addition, continuity in health services, health education, and social services were also added as eligible services. And very importantly, the reauthorization also included the creation of the National Advisory Council on Migrant Health, which remains an important and critical aspect of the program. The council gathers information from migrant health advocates and farm workers around the country to formulate recommendations that are presented to the Secretary of Health and Human Services. Also during this time, there were a number of protections put into place for agricultural workers. And of note, the Immigration Nationality Act was modified in 1986 to create the H-2A program, which provides for the importation of temporary non-immigrant foreign workers to perform agricultural labor services. And as you all may know, this program continues to grow every year. In 2021, there were 250,000 visas issued through the H-2A program. Next slide. Now, a major highlight from the 1990s was the Health Center Consolidation Act, which consolidated 4 federal health primary care and prevention programs, all under the same umbrella: community health, migrant health, healthcare for the homeless, and healthcare for residents and public housing. It also added the inclusion, now here you go, here's another category, of aged and disabled migratory ag workers to the definition. In 2001, President Bush introduced an initiative to double the number of patients served by health centers by 2006. And under his administration, the health center program expanded to serve over 16 million people. Then under the Obama administration, the Affordable Care Act established the Community Health Center Fund and provided $11 billion over a 5-year period for the operation, expansion, and construction of health centers throughout the nation. Both of these initiatives benefited the migrant health programs around the country with additional funding. Next slide, please. Now, with increased funding, ag worker advocates saw that more could be done to increase the access to care for agricultural workers and their families. The Ag Worker Access Campaign was launched in 2015 as a joint effort by the National Center for Farmworker Health and the National Association of Community Health Centers. And as I mentioned before, we are joined by a task force formed of various organizations to help guide campaign activities. The goal of the campaign is to increase the number of agricultural workers and their families served in health centers to 2 million. And although we're not there yet, we absolutely keep working on that target. We also highlight and celebrate migrant health champions. We identify promising practices, and we support the continuation of engaging multi-sector partnerships to address the social determinants of health. Next slide. So the last 2 years have been very challenging for all of us. And with the advent of COVID-19 pandemic, farm workers and the health centers that serve them, wow, weren't they? They were front and center. Both farm workers and health center staff were deemed essential workers. And the Community and Migrant Health Center program once again demonstrated its success in meeting the needs of the farm worker community. Today, there are more than 174 migrant health centers, and together with the network of community health centers, they collectively serve nearly 1 million farm workers every year. So there's a lot to celebrate. And today we have the privilege of hearing from 2 health center representatives. And I invite Alicia now to introduce their stories as we hear from them about their own passion and commitment to serve the farm worker community. Alicia.
Thank you, Sylvia, for sharing these brief historical highlights with us on such an important movement. One way that the Migrant Health Program will continue to prosper and grow is through the efforts of migrant health champions, like all of you today participating in this webinar. Migrant health champions are those who are working to increase access to care for ag workers, and many have very personal connections to their work and to why they serve this special population. As we celebrate the 60th anniversary and reflect on the history and milestones that have led us to where we are today, we want to take some time today to share some stories from the field to help keep these personal histories alive. So we will be hearing from 2 champions who have previously recorded their message for you today, who will be sharing their journey from working in the fields to becoming champions and leaders in migrant health. The 2 speakers were both farm workers with their roots in California and now are working in community health centers. Our first featured speaker will be Graciela Soto Perez. She's the CEO at Altura Centers for Health in California. And then following Graciela, we're going to be hearing from Cristina Rodriguez, who is a physician assistant at Altura Centers in California as well. So we're going to turn that over now and hear their stories.
Executive Officer for Altura. Hi, my name is Graciela Soto Perez, and I am the Chief Executive Officer for Altura Centers for Health. We are located in Tulare, California, and we are also deemed a migrant health center. I want to thank the National Center of Farm Worker Health for acknowledging and celebrating the 60th anniversary for migrant health. I just want to share a little bit about myself as a migrant worker. I was born in 1976, and from very young start, my family were migrant workers. We would migrate to Fowler every summer in Fowler, California, and we would do the table grapes. And back then, it was allowed to do child labor. Children got to work in the fields. So what we did, we would migrate to do the grapes for the raisins in the Fowler area, and we would stay there with the farmer that we would do all the crops. Luckily, he allowed us to stay in some of those garages he had. And then from there, my dad would ask them if we could stay and continue to do the rest of the crop until it was over, and he allowed us to do that. I remember back in the days when we first started going every summer, we would all go use the restroom. Weren't toilets; they were a wooden structure with holes on it, and then whoever left, then they would bury the everything that was there. And for the trash, we would bury a hole, whoever arrived first. There were 2 families. It was ours and somebody else, and a group of single men who would do the crop. We hardly would be there, and it was long days. Like I said, I could remember that we would come home late for school every year, so we were always having to catch up. I went to school in Woodlake, and a lot of the people who attended Woodlake were also migrant workers at the time. So we would start school later, but we were still come in much later than the rest. But we weren't as far behind, but we still had to catch it. I remember my father saying, well, at least we don't have it both ways, where we would start school late and we wouldn't finish school. There were many families who had it both ways because they would continue to migrate and follow the crop in May. In May, they'd go to do the cherries and they go to Stockton, and then the apples in Washington and Oregon, and they moved that way. Whereas we just did the grapes and what was the crop up there in that area. So after the grapes, then came the olives. The olive seasons was around September or October, and we farmed the olives during vacations and holidays. So I didn't look forward to holidays or vacations like the rest of my peers, because for me, it meant getting up super early in the morning to go to work and working in the fields. When it rained, there were snails all over. In the heat season, there were rattlesnakes. So you just learn to work with it. So after that, and then we have the citrus, which is the oranges, then the navels, and then the Valencias. As soon as I turned 12, back, that was in the 80s, my dad asked me to go get the permit from the school, because then at that point now you needed permits. And so at age 12, I got my permit so I could work in the citrus, and all these years just working along with my dad and my mom. So another thing I remember about working in the fields is we many years later went back when I was in high school to see what had become, because after a while we stopped doing the field crops, and the owner, Floyd Wagner, and his wife, Emily had already passed away. They were an older couple, and we were very thankful. I mean, they weren't luxurious. He let us stay in their garages, but we didn't have to stay in tents. Some people would when they migrate, they stay in tents, they shower in the rivers, and throughout the years, they built some toilets, nice places for us to at least get what we need. And they had to get rid of it. They said they had to stop it because of housing. They felt it, they got an inspection, and so they had to take it all down. It's very unfortunate, because that means they have to find some other places to stay. And so that's what I recall from those days. And being a migrant student as well was, at the time, back in the days, there were more resources, I feel, than there are now for migrant students. I feel that I can say that thanks to the migrant program in the Tulare County system, I am where I am today. My parents had no more than maybe third grade education. My mom maybe fifth grade education. So education was not a priority. But the migrant program had migrant counselors in our school system. And Lydia Olguin was my migrant counselor at the high school. And she had me participate in programs such as Mente, which is we stayed in Fresno State for a summer, my junior high school year. There were programs that taught you about bringing your culture. So I got to learn from the history, and I got to learn from wonderful people who have gone through me, and also learned about other Hispanic role models that were positive role models that I had never heard of, because you don't learn about that in the schools. And just we're living in Fresno State for the summer, getting the feel for obtaining a higher education, what it was like. It was inspirational. And I think that's what motivated me to get my 4-year degree, and then later on get my master's degree. So I am the first to graduate from a 4-year university and from a graduate school in my family. And I attribute it all to the migrant program. Unfortunately, many of these programs were cut, and so some don't have that opportunity, but I continue to support any programs like that in my occupation as now the Chief Executive Officer for a federally qualified health center. One thing that is very rewarding, how I say I am helping now our migrant workers or agriculture workers, is working for a federally qualified health center who is deemed as a migrant health center. And until recently, I didn't realize that, because we hear a lot about the Section 330 dollars, and I learned about the history of the movement of the FQHCs, but I think a lot of people don't mention the Section 329, which came in before Section 330. And it dawned on me, it's really thanks to the migrant movement that also helped the support and creation of the Section 330 dollars, which is what FQHCs receive funding from. And so with that, we do many outreach services. We have promotoras, which are a bridge from our community to the clinic. Some only speak Spanish, some are bilingual, but that is a way to connect with the community and the farm workers. And this was something that I'm under the understanding that was a model from that started in Mexico. So it's nice that we are able to implement a successful program such as that. We also have the cuadrillas every Friday, which we partner with La Bonita radio station here in Tulare County. And we provide free lunch along with other sponsors. We're one of them, but we go out in the fields. We do more than just outreach. We provide education, help with enrollment. How can we get you covered so that you can obtain healthcare coverage and finance it? And we also provide iron test. We test their iron, their blood sugar, because diabetes is one of those high issues we have here. Also cardiology, so we have to take their blood pressure. So we take their vital signs, and that helps educate them. And if there's any red flags, how can we continue to help you so we can take better care of our patients? So we do the cuadrillas, and we also do events. We provide to food through partnership with Food Link. So we do try to use a lot of our community partners as well. The Tulare Community Care Coalition, sometimes they have information, Consulado Mexicano in Fresno, other participants, and we connect our farm workers to that service. Another thing we do when we do the cuadrillas, our outreach team goes out there, they will go out and the employee will pick, say for example, if they're doing the grapes for the grocery store, they'll pick while we're educating them so they don't lose production. And that way there's no penalty and they continue as they have to support their families as well. So educate them and help contribute. And so we do a lot of things in the community to try to support our farm workers. And that's something dear to my heart because I was a migrant student. My father also later on became a crew boss called mayordomo here. And so it's just, I like to support this community and I want to thank everybody. It's been quite a journey, but thanks to the resources that I received from the migrant program, I feel like I am who I am today. And I also want to thank the National Centers for Farm Worker Health because education and training doesn't end. We use their services to help us train our employees to capture the data of whose agriculture was defined as migrant. Sometimes we need that assistance. So it's very nice to have those resources and support. So thank you very much for that.
Hello, my name is Cristina Rodriguez. I am a physician assistant working in family medicine for Altura Centers for Health. I work in a small rural town called Woodville, and the population size is about 1,700 people. And so it's relatively small and interesting. We have a migrant camp nearby, so we do get a lot of patients from migrant farm workers come in through the clinic. And as when I was a teenager, we would go to a town called Carruthers, and I would help my grandparents and my parents harvest grapes. And once we were done harvesting grapes, then we would then work with after the grapes were dried, then we would go ahead and have to kind of roll the paper and get them prepared and ready so they can pick them up and take them to the raisin farms and get them out to the consumers. So I grew up in a very small town, and it's called Lemoore, California. And I lived out in the country, and my parents have always been farm workers, including my father. He's currently a farm worker, and he's retired already, but he loves to work out in the fields and drive tractors and plant and seed and harvest. And so he says he doesn't know what he would do if he didn't work. And so it brings a lot of joy to him. And so growing up out in the country and being exposed to farm labor my nearly entire life, I felt like I needed to give back to my community and work with the migrant farm worker community. I feel like these people, they really need good healthcare, and I felt like it really provides a lot of how should I say it, professional satisfaction to me, being able to service this type of population, because I have a close connection with these people. And so I feel like there's a lot to do for this particular community as far as healthcare. There's a lot of need in this particular patient population. And so I feel really proud to be able to be here for them, and also speak their language. I do speak Spanish. It is my native language. And so I feel like I'm able to communicate much better with the patients, especially if they know that you can speak their language. I feel like sometimes do get lost in translation. So it's nice when I see somebody and they're like, oh, you speak my language. It's almost seeing them like if they were family. So it is very, very rewarding to be able to work in this patient population. And so, yes, so I'm very proud to be part of the Altura family, and proud to be working in the community that I work at. And so that's about it. Thank you.
Again, we want to thank our speakers, both Graciela and Cristina, for sharing their experience with us and why they remain so passionate with working with this special population. And I feel these stories really underscore the importance of culture and education, outreach, and also through those valuable partnerships that really truly strengthen access to care for farm workers. So we hope that their stories, that these voices really resonated with you or encourage you to also share your story, or even collect stories from others in your community. This can be a really impactful way of keeping this movement or this momentum alive, and keep farm workers at the forefront of everything that we do. So we encourage you to do the same as you think of ways to celebrate the 60 years of migrant health. So again, thank you to these speakers, and we hope you enjoyed this segment of the presentation. So if we can go to the next slide. So what's next here for you all as you move forward in championing or celebrating the 6 years of migrant health? We wanted to share some resources that we know you will find of benefit as you move forward. As previously mentioned by Sylvia earlier, we're not here today to not only to celebrate the 6 years of migrant health or the Migrant Health Program, but we want to support your efforts to continue recognizing agricultural workers as essential in our communities. We want to keep the goal of the Ag Worker campaign alive. So we want to offer you some valuable resources that you can use to go forward and share with your colleagues and your coworkers and other partnering organizations in the communities that you serve. So first, we want to share the resource. You'll have access to this full recording. So please share this full recording with your staff or other colleagues that were not able to make the webinar today. You'll be receiving it following this webinar, but you can also find it on our website with other archived webinars. In our NCFH website, and you'll see all the links here on these slides. You'll be able to have access to all of our resources, all of the archived webinars. You'll find similar ones like the one we've done today around the history of migrant health. You'll find other important webinars like how to accurately identify and classify ag worker patients in your health center. So we encourage you to visit these archived webinars because there's so many topics that you can use as you provide ongoing training within your health center. In addition to the archived webinars, you'll also see a set of historical timeline slides. Now, these historical slides are some you saw today during Sylvia's presentation when she provided some history. We want to make sure you also have access to those history slides. And along with the slides is a script. So as you move forward to train other staff members or just view it perhaps during a special lunch and learn session within your health center, you'll be able to have all of these slides with the script. So again, a training tool for you to use whenever, however you see fit. In addition to the historical slides and script, we also wanted to share with you a video that you can have access to called Keep Hope Alive. And this is a very special video if you have not seen it already, but it was a video that was actually developed when we were celebrating 30 years of the Migrant Health Program. So it provides a lot of that historical context, and you'll see a lot. It's very relevant today. And again, it provides this history of migrant farm labor, and it really talks about how the Migrant Health Program began. So you'll see that link there as well. It also makes a very good training tool, especially for like new staff that come to your health center that may not have any understanding of this movement at all. It really just provides a very interesting way of understanding the history. So again, we encourage you to access that video. And lastly, on our website, there is another historical slideshow that you will see. It's called The History of Agricultural Workers and the Migrant Health Movement. It contains historical photos of agricultural work from the 1900s to the 1990s. So when you visit our website, you can just easily hover over the photos and you'll read additional information about that photo and the history that it pertains to. Great resource, again, along with all these other historical PowerPoints and scripts that you'll have access to for ongoing training. So we encourage you to use them. Again, it's just an important way to help others understand the important work of America's farm workers. So if we go to the next slide, here's some other resources that we wanted to share with you in case that you've missed them on just additional health resources. So what you'll note here, again, you can access them at any time on our website, download them and share them also with other community partners. But the first one we wanted to share with you is what we call a 2014 Migrant Health Newsline commemorative issue. For those of you who have been following us for quite some time, the Migrant Health Newsline was an older publication of NCFH that we no longer have. But on our last issue of the Migrant Health Newsline, we really wanted to reflect and take a look back at the evolution of the Migrant Health Program. So when you look at that special issue, that final issue, you're going to see, again, a lot of information about the migrant health movement. We take a look back, and then we also offer some insights about the future of the Migrant Health Program. So if you haven't seen it, we encourage you to take a look at it. just another historical, an historical resource that you have to add to your toolbox. In addition to this special commemorative issue, you'll also have access to some population estimation information on our website. If you go there, there's an interactive tool that will allow you to look at an estimated number of agricultural workers by county in any given state. Again, the URL is there. We encourage you to visit that if you're more interested in some estimated numbers of farm workers in your service area. In addition to population estimation, we want you to make sure that you are able to access all of our farm worker fact sheets and reports. We have so many ag worker health fact sheets. If you need just to access something quickly from literature, from a lot of literature that's out there on farm worker health, you can access that there. Different health topics. We have a lot right now that you can access, of course, on COVID-19 and farm workers. In addition to the fact sheets, we want to also share with you that we have a plethora of health education resources we've created. I want to showcase 3 in particular are some toolkits or resource hubs that we've created around diabetes, mental health, and determinants of health. Earlier through some of our speakers, they talked about the importance of just culture and language. For us at the National Center for Farmworker Health, we are always striving to produce low literacy, culturally appropriate resources. If you access the hubs, you will see a collection, a lot of resources that keep those factors in mind. So again, diabetes, mental health, social determinants of health, and of course, our COVID-19 resources, which are excellent resources that you can use not only in your outreach and education efforts, but please share them with others in your health center because they make excellent training resources as well. Lastly, I just wanted to point out our health center toolbox. This is a toolbox that's rich with a lot of different resources, policies and procedures and forms. So if you think about what we've been talking about today, increasing access to care for farm workers, this really provides health centers with the tools to do that in an effective way. So what are the questions that we should be asking to accurately identify farm workers that come into our health center? You know, what should our practices look like? What should the policies look like within the health center to ensure that all of us are implementing the same practice, that we're asking the same questions, that we have a standardized way of practicing and doing all of these important things around increased access to care for farm workers. So there's a lot of support information there for you, for health centers, really to help you address all of the important health center program requirements. So if you haven't seen any of these resources, we encourage you to do that. So if we go to the next slide, as you know, social media has played a really important part in all of our outreach and education efforts, and we really saw that increase quite a bit during the pandemic. So we've created some social media collateral for you as well, for all of your future efforts, especially around 2 important milestones that we want to share with you today. One is the celebration of National Health Center Week, which is coming up in August 7th through August 13th. And also on August 9th, we have National Ag Worker Health Day. So I'm sure that all of you know about these important dates. So we wanted to make sure that you have some resources and some links and on our website that you can easily access. So here are a couple of things I wanted to share with you. So you're going to have access to 2 versions of a social media post that you can use during Health Center Week and Ag Worker Day on August 9th and August 7th through 13th. So the first one you'll see is it's not editable. And the second one is you're going to be able to edit this social media post. You're going to be able to add your own health center logo and customize it before you post it to the social media site. Again, I'm not going to give you all the details of the instructions, but if you go to the website, you're going to be able to find exactly how to edit and use it and download it accordingly. In addition to this collateral, we have some draft language that you can use in the description of your social media post for Instagram, Twitter, and Facebook, as well as recommended hashtags to use during these important events. Again, so you'll have the instructions when you visit our website to access these resources. In addition to those things I mentioned, you'll also have a web button that you can display on your website to notify traffic about your commitment to the ag worker population. Earlier, we talked a little bit about the Ag Worker Access Campaign. This is one way that you can support the campaign by ensuring that you have some of that information on your website. Again, on this link that you see here posted, you'll find additional information about the campaign, the resources you can use, and how you can be more involved with the campaign. We have also provided a static PowerPoint slide that you can use as you go forward and using some of the resources that we're sharing today. And if you want to add campaign information as well, we've provided you with a slide that you can use in going forward and celebrating all of these important events. We have this beautiful anniversary logo as well that you can use to this year to celebrate the 60 years of Migrant Health. So it's the one that you see up here on the screen. Again, you can download it from our website and use it in any of your social media posts or presentations that you plan to have in the future. And one thing we did want to share with you as you continue to celebrate these events, and especially during National Health Center Week, we really want you to use these social media collateral. Please tag us, use the campaign hashtags. And when you do that, we'll be sending you little gifts. We'll be sending mini prints of our artwork as prizes as you do that. So again, part of keeping this momentum going and keeping this movement alive, we encourage you to really engage in these really important events. So I want to thank you in advance for doing that as part of this movement. If we go to the next slide, lastly, I just wanted to share some other things to consider. In CFH, we really work hard to provide high quality training and technical assistance to health centers around the country and really helping you achieve your goals to increase access to care for farm workers. So we have a whole set of training tools designed to help health centers and other organizations set some goals to increase the number of farm workers served in your community. So we want you to visit these workforce development trainings, as well the descriptions on our website, and please reach out to us if we can be of further assistance to you as you create some strategic planning or some action planning to increase access to care for farm workers. Next slide. We invite you, if you're not already signed up for the campaign, we invite you to be part of the campaign with us. You can sign up as an individual or you can sign up as your organization. We have provided a QR code for you here so that you can easily join. And when you join the campaign, you'll be receiving on an ongoing basis any new tools that we develop, like the ones that we shared here today, resources that we develop, opportunities that you will have access to support increasing access to care for ag workers in your community. So again, we invite you to join us, and we'll also be sending you some promotional materials. We want you to promote the campaign on your website, and as I previously mentioned, through your social media outlets. That's really important to keep promoting these all of this information that we shared with you here today. So we go to the next slide. Again, we thank you for being here with us today, taking time to learn a little bit more about the history of migrant health and to prepare you to move forward in your efforts to keep celebrating until September of this year, when it's the actual anniversary of the Migrant Health Program, and of course beyond. We encourage everyone to continue to share your stories, share these resources to others. And we here at the National Center for Farmworker Health, we're always here as a resource for you, and we encourage you to reach out. And we have a website here that you can definitely send more information, or if you have questions, we encourage you to contact here this website. And so again, thank you all for being here with us today. For those of you who are perhaps going to be listening to this webinar, we thank you for paying attention to all this information. And those of you here live today, we ask that you just stay behind a little bit so you can fill out our brief evaluation. So again, thank you for being with us today.